talked earlier about, sadly, a record-setting day and days in regard to hospitalizations. And so I thought it would be good to bring in someone who you've heard from before, and someone who really is involved not just in what is going on in Columbus, Wexner Medical Center, but he is directly involved in the system that we have set up statewide. So we have divided the state early on in this pandemic into 3 different zones, and some of the lead hospitals take the lead and work with the other hospitals. And I know, let me just introduce Dr. Andy Thomas. Dr. Thomas, thanks for being back with us. We appreciate it very, very much. And I know you and I were talking before we went on the air. You're on the phone with these smaller hospitals, I know, several times a week, and you're on the phone a lot with the hospitals in your zone, your particular zone as well. So just tell us kind of what's going on with our hospitals. We know we're seeing this hospitalization go up. We don't like to see it, but what's the status of our hospitals around the state?
Thank you, Governor. Thanks for having me here today. So in terms of what we're seeing with hospital census for COVID patients, we are certainly at the highest point that we've seen across the state at any time during the pandemic in terms of total hospitalizations. Here in Zone 2, we are at our highest rate since back in early May. Zone 3 is actually at the highest rate that it's been at any time during the pandemic.
Andy, remind everybody where Zone 2 is, where the 3 zones are.
Happy to. Zone 1 spreads from the northern west part of the state through Cleveland, Youngstown, Akron, Canton area, and Bob Wiley, who's the chief clinical officer at Cleveland Clinic, leads Zone 1. Zone 2 is regions 4, 7, and 8. Region 4 spreads up 33 northwest of Columbus down through what we would call the Central Ohio contiguous counties to Franklin County. And then essentially everything 23 south, 33 south, and 70 east, that southeast quadrant of the state. And then Zone 3 are regions 3 and 6, which are essentially the Dayton metropolitan area and everything to the west, and then the Cincinnati and southwestern part of the state. Rick Lofgren from UC Health is the lead for Zone 3. So what we do as zone leads, to your point, Governor, 2 days a week, I'm on the phone with local public health folks here in Columbus, as well as the lead clinicians for large group practices here in Columbus and the Columbus hospitals. 3 days a week, we're actually on a call for all of the hospitals in the zone that have COVID patients in the hospital. Once again, talking about their capacity, talking about the volume of patients, making sure that we're coordinating things well around the zone. In fact, just yesterday at noon, we stood back up our regional transfer center here for Zone 2 so that any hospital in the zone that needs to move a patient to Columbus, either because they have too many COVID patients to manage in their hospital or a patient is too ill to be in their local community hospital and needs kind of a higher level of care, any of those hospitals in the zone can call and essentially get a centralized call center so that we can make sure the patient is going to the right place at the right time to move between hospitals. Also, in terms of clinical updates, 2 Fridays ago, we had 130 infectious disease, emergency department, critical care, and hospital medicine physicians, plus pharmacists and nursing leaders from all the zone hospitals on the phone talking about the latest treatment protocols for COVID-19. So we did that a number of times over the summer related to remdesivir. And this conversation covered both remdesivir as well as convalescent plasma, steroids, and a variety of other treatment protocols. So the zone leads in Zone 1 and Zone 3 have similar cadence of meetings with the hospitals and providing that sort of support for physicians at the local level so that they don't feel like they're out at the end of a limb.
That's great. So I interrupted you a few minutes ago. I asked you to kind of define the zones. Go back and tell us again, let's start with northern tier of Ohio. What are we seeing in that zone? What are we seeing in the other 2 zones?
Sure. Well, the numbers are up in every zone compared to earlier in the summer. Certainly, we all saw a peak in the spring and then another peak in that late July, early August timeframe. But Zone 3 is the one that is actually at the highest point at all during the pandemic. And Zone 1 and 2 are certainly higher than we've been now for about two and a half months. So the total number is certainly higher than we've had at any time during the pandemic. But I think what's really important is to talk about the distribution of those patients. So regions 7 and 8 in my zone are the rural areas of the state where you have smaller hospitals in their local communities. And actually part of our strategy is to make sure patients that may be, ill enough to be in the hospital, but not ill enough to need a high level of critical care or high-end treatment that may not be available at those hospitals. We want to try and keep as many patients locally as possible. So those regions maybe saw 10, 15, 20 patients in the past, might be at 30 to 50 patients now. So we're doing our best to support those local hospitals. There's excellent doctors, nurses, pharmacists working in those hospitals. And if they are capable of taking care of patients, we want them to stay as close to home as possible. But when you look at the distribution of where patients are coming from across the state that need admitted to the hospital, it's very different than that April, May time period where it was mainly patients from the metropolitan areas of the state and some of the suburban areas around the big cities where hospitalizations occurred. I think one other major difference now is the number of ODRC inmates that need to be in the hospital. We're seeing far better numbers in terms of the number of inmates that need to be admitted. The system for the state has done an excellent job, once again, of trying to take care of anyone who does become sick at their local facility. But obviously, we're here as a backup, as a hospital for any of those inmates that need admitted. So I think those are probably the biggest differences is in the distribution of the patients this time around, as well as just the overall numbers.
So more coming from the rural areas, more coming from a larger area of Ohio going into the hospitals.
Yes, correct.
And we're now at a high, but you and I've talked. You're not alarmed at this point. Tell us kind of the level of concern that we should have, because I get asked that question, so I figured I'd put the expert on.
Understood. Well, thank you, sir. Understood. I completely understand the question. We've been having this discussion on all of our local and zone calls for the past 2 weeks because we've seen these numbers start to trend up a few weeks ago. And all of the hospital executives and administrative and clinical leadership that we talk to feel that at this time we're doing okay. The concern I think that we have is we're not seeing the number of cases peak. We're not seeing the number of hospitalizations peak. And until we know where the peak of that curve is, it's a little anxiety provoking to say if we got to double or triple the numbers we have now, not saying that's where it's going to go, but at this point, we just don't know where it's going to top out. So right now, all of the hospitals that I speak with feel that they can manage this level of capacity. Back in the spring when we had somewhat similar numbers, slightly less than where we are now, the majority of our elective operations were actually shut down. So we actually had a lot of extra hospital capacity. We're back at a period of normal operations for our hospitals. So at some point, if the numbers just continue to rise and rise and rise, we'll run into some difficult decisions to make. But right now, we feel we have the capacity in our hospitals. We have surge capacity, especially in most of our larger hospitals, to actually increase the volume of patients that we take care of. So for the time being, we're okay. But at the same time, if we don't start to see the numbers start to peak and come back down over the next few weeks, heading into what is normally a winter flu season where we already see in December and January relatively high hospital occupancy numbers, I think those two issues will collide at some point if we don't see a change in the trajectory of our total cases and our total hospitalizations over the next few weeks.
Well, I know you've seen the chart. I don't know if you can see this one, but for our viewers, this goes from April to October 16th, and this is the patient count in the hospital. So it's not how many are going in every day, but it's what the census basically is in the hospital. And Doctor, you were talking about basically we don't know where this peak is. We've clearly not hit a plateau yet.
Correct.
And so we are always looking for that plateau. We're really looking for it to go down, but we're at least looking for a plateau. But it's been so this is for everyone. This is the number in the hospital. This down here, the darker blue, is in ICU, and below that is in those who have a vent. So you can see those going what's happening with those numbers. So
the ICU numbers and the ventilator numbers tend to lag the hospitalization numbers a little bit. Most patients, when they present to the hospital, don't end up in the ICU for a number of days. Some do right off, but most for a number of days later. So those will tend to trend up as the total hospitalizations continue to trend up. You know, as hospital leaders and physician leaders, nursing leaders, pharmacy leaders, we all are taught to prepare for the worst case scenario, whether it's about any one individual patient or in this case, a pandemic. So I know all of my colleagues are thinking about where do we go if 2 weeks from now the numbers look like this, or 4 weeks from now the numbers look like this. We are preparing for the worst case scenario. At the same time, our goal in making sure people understand what they need to do to try to get these numbers to peak are the exact things that you describe on your press conferences and in your other speeches around the state. It's relatively simple things: wearing a mask, distancing from others that don't live with you in your home, washing your hands routinely, and making sure that businesses and other public areas are keeping high-touch areas clean of any risk of having the virus on them. They're relatively simple things that will hopefully, to your point earlier, even this afternoon, sir, that we've done this before. We've bent the curve and kept this from becoming a worse problem than it's been twice over the past 7 months. And I'm sure the citizens of Ohio are up to the task again.
So summary, numbers going up throughout the state, all 3 zones. Much more coming from the rural areas than we saw in the spring. And any one region, I think you mentioned one region worse than the other, or is there much different?
Zone 3, which is the southwest portion of the state, is seeing, once again, the highest numbers that they've seen at any time during the pandemic. They barely got to 300 patients. I believe this morning they were in the 370 range. They barely got to 300 patients over the summer. So it is definitely feels very different to my colleagues down there. We were just on a call yesterday morning discussing that. But it's really, it's distributed all across the state.
Right.
Region 7 and 8, which are the rural zones for Zone 2, are seeing the highest numbers over the past 10 days that they've seen at any time during the pandemic in their hospital.
Which is generally Southern Ohio, South Central, Southeast Ohio.
Correct.
They're seeing more than they've ever seen.
Correct.
Doctor, thank you very much.
Thank you.
Appreciate it.
Take care.